trouble with being a GP is that there's an expectation, both from ourselves and others, that we know everything about everything. We all know that that's not humanly possible. So most of us settle for knowing something about everything, a lot about some things, and most importantly, knowing someone who can fill the gap. A large part of our job as general practitioners is to know what resources are available to help our patients. The internet has provided volumes of material over the last 2 decades, and not all of that material is good for either us or our patients. However, not all of it is bad either. It has been long recognised that the internet provides enormous potential for healthcare delivery, particularly the delivery of mental health care resources.
E-mental health's been around for at least 25 years. The first study that's really well known was conducted in 1990 in the United States, comparing a computerised CBT program with a therapist-delivered CBT program and a control condition. And both the therapist and the CBT program delivered by the computer were both effective. There is a strong amount of evidence that e-mental health services or treatments are effective. There's more than 40 research trials showing that they're better than placebo, and there's also quite a few studies showing they're as good as therapist intervention. From the point of view of somebody who's developed them and has got an idea of their potential advantage, I think the thing is that people like them. If they suit a particular person's way of getting help, then they can be highly effective. So I think if the barriers can be overcome for their use within general practice, then that's an important thing to know, that generally speaking, people do gain benefit from them. I guess one of the important things from my perspective anyway is that this is just going to take off. This is a growing area, and it's important to recognise that more than anything.
Access to mental health care has improved dramatically over the last decade or so, but there are still huge gaps in service delivery and in terms of patient reluctance to access the available services. Knowing about e-mental health can help you fill those gaps and overcome the barriers. There are a growing number of e-mental health resources available, from consumer support websites to online therapy. But how do we know what works and what doesn't? Of course, the first step is to satisfy ourselves about the evidence base for these programs to ensure that we feel we're prescribing responsibly. Then we need to find a set of evidence-based programs that we are familiar with and can comfortably recommend to our patients to use. We need to learn which programs are appropriate for which patients, and importantly, how to integrate recommending those programs into our usual practice methods. It's a familiar process that we've all been through before. Each time we need to learn about new treatment options for specific conditions, for example, diabetes or hypertension. The Black Dog Institute, as part of a federally funded project called E-Mental Health in Practice, or MPRAC for short, is endeavouring to make life easier for you by producing a series of webinars and an online educational program to make you more familiar with the evidence-based, Australian-made e-mental health programs that are available. Please take the opportunity to learn about the sort of resource that is useful to our patients and to us now, but that is increasingly going to become part of the general practice landscape in the future. These educational programs are free and accredited by both the RACGP and ACRRM. And best of all, they're easily accessible either live or in the recorded form of all places on the internet.